The Posh PA, and today I'm going to be answering a common question that I get, which is, Michelle, why did you become a PA and not a physician, not an MD or a DO? And that's obviously going to be a very personal story in which I'm going to have to take you back in time. But during this video, I will provide you some facts about both the PA profession and the MD/DO profession so that you can make a decision if you're having trouble deciding which career might be best for you. But before I get started, if you haven't already, please hit the subscribe button. I'm here every week dropping tips and tricks, not only to help you get into PA school, but help you be a successful student and a fulfilled practicing PA. Okay, buckle up and get ready for this story because I'm going to have to take you back in time to when I was an undergraduate at the University of Connecticut, majoring in genetics with a minor in molecular and cell biology, and I really thought my passion was to be involved in laboratory science. And I graduated from college, got a degree, like I just mentioned, with a minor. I actually got a postgraduate certificate as well, and then I worked at an amazing cancer research hospital in Boston where I was doing basic science research. Over the course of the time that I was there, I started to realize that I really wasn't feeling excited about my career or fulfilled in a lot of different ways. And I started to explore what my different options were at that point in time. So at this point, I'd already graduated college. I was about 2 years out, and I was at a crossroads in my life trying to decide what I wanted to do next. If anything, did I want to get a PhD? Did I want to go to medical school? Nursing, nurse practitioner, PA, so many different options, right? So at that moment in time, I was discussing it with my parents, and they mentioned that a family friend was a PA, and maybe I should talk to her more about her training and what working as a PA really looked like. And when I talked to her, she really highlighted a lot of the most amazing points about this profession in the fact that it was a shorter time to training. She was able to start her job a little bit more quickly, that she practiced autonomously, but in collaboration with physicians, providing a lot of the medical care for her patients. She had a lot of job satisfaction, and it really sounded exciting. But I wasn't quite sure still at that time if PA was the right decision for me, or if clinical medicine was the right decision for me. So I asked the physician that I was working with in the lab if I could spend a day in his clinic. And very shortly after that, I knew that I was on the wrong side of medicine, that I really wanted that patient interaction, that I really wanted that clinical medical knowledge to be able to help people. So at that point, I really did need to make a decision on what path I wanted to take. And a few reasons that I chose the PA profession. Number one, when I decided in my life that I was going to go back to school, I was at a point in my career where I wanted to get out in the field. I wanted to start, helping patients and doing things more quickly. And the shorter time to training was appealing to me, right? But I also wanted to make sure that I was still going to get a comprehensive education and be prepared enough to go out and help patients appropriately. So in doing research about the profession, I realized that the training was very rigorous, but it was about 27 to 36 months in length, depending on the program, and that I would be fully trained over the course of a didactic portion, as well as multiple clinical rotations over the course of these 2 to 3 years, and have to take a board exam at the end of that to practice as a certified PA. One of the things I really loved about this profession was the collaborative aspect. I loved the idea of being able to work with someone else as part of a team and really have that collaborating physician to learn from, to ask advice of, and to really offer different opinions so that we could best help the patient and impact outcomes. So that team factor was a really important thing for me. The other thing was I could see the trajectory of my future. Although I wasn't sure I wanted to have a family, or I wanted to have a big family, or if I wanted to travel or do all these things, they were things that I was thinking about having in my life. And I saw the PA profession as an opportunity to have a medical career that would grow and change with me as my personal and professional goals changed over time. What do I mean by that? Well, when I first graduated PA school and I started working as a PA, I was working a lot of hours. I was very excited. I was learning. I was all about my career. And as I moved on throughout my life, I really took leadership roles in each job that I had chosen. I was president of a large PA association. I really wanted to expand my career and my horizons and really was focused in the medical oncology arena. I was doing all of those things and working really long hours, and I became a supervisor and involved in management and really tried all of these different things, including being an adjunct professor at a PA program. So I was able to really expand my horizons beyond clinical practice and adapt it to the point in my personal life that I was. And at that time, I am in fact married to a surgeon, disclaimer. So I had to move 3 separate times with Dave for his medical training, right? So we were in the Northeast. We moved to Miami for 5 years for his residency. We were in Houston for 3 years for a fellowship. So being a PA, that entire time allowed me to move with him, to be able to get a job in every state that I practice. Yes, you do have to get a state license, no matter what state that you're practicing in. That's a separate video. But I will say that it allowed me to have the flexibility to be able to move to different states, to be able to practice in different specialties and really hone in on the specialty I loved, which was oncology. So when Dave and I finally decided 11 years later to settle down and have a family, I decided that I no longer wanted to work full time, as a PA. And I was able to really find a position as a PA that will allow me to work part-time and still be home for my family and do all the things we all want to do outside of work, right? So it really allows me that flexibility to create a career that I want, that's in alignment with my personal goals as Michelle, as now a business owner, but also to continue in my clinical practice. So even back then, I could see the potential of this career to be able to do that. Now, I'm very careful not to use the term work-life balance as a reason of why I chose to become a PA, because I will tell you right now, there are a lot of PAs practicing right now that have very little work-life balance. And that is not a reason that you should choose a profession, because work-life balance is something that you create as a person in any profession that you are going to go into. Also, I think it's a little bit of a misnomer. There's never quite a real balance. It's more of a work-life harmony, but no career hands that to you. You have to create that yourself, whether you're a physician, a PA, an NP, whatever it is that you do, you have to create that and really be invested in creating a work-life harmony that works for you. I will say that being a PA allows me to more easily create that work-life harmony because of the different opportunities that are available to me, both clinically and non-clinically. That brings me to point number 3, which I mentioned a little bit. A lot of people will say that they chose PA because of the lateral mobility. Lateral mobility means that you are able to change specialties throughout any point in your career without having additional training required, because our PA education is training us as generalists. Now, I will say that I personally do not like the term lateral mobility because it suggests that there's no upward mobility. Yes, we do have the option to treat any patient in any specialty across the lifespan. And that is very unique about the PA profession. But I will also say that there is opportunity for upward mobility, including non-clinical tasks, which I do have a whole separate video on in my library. So check that out. But I will say there's opportunity for growth outside of clinical medicine and within, including administration, research, teaching, pharmaceutical industry, starting your own business. So many different options for you to engage in leadership and really have more upward mobility, along with that amazing versatility of the profession that you can change specialties if you're somebody that's worried about committing to one thing and being an expert in that field. That brings me to my next point, which was I really couldn't hone in on the idea that I would have to be doing the same specialty for my entire career. I really struggled with that back in the day. In fact, I was a little bit of a flip-flopper, even going to college as an undergrad, and I thought I wanted to do physical therapy, and I wound up changing my mind. And I was worried that if I chose the MD or DO route, that I was sort of locked in to this specialty. And I just liked the idea of having more flexibility. With that being said, I have been in the same specialty for 16 years. So at the end of the day, I wound up choosing a specialty that I loved and stuck with it for a really long time. But I wouldn't have known that back in the day. And I have practiced in other specialties prior to entering oncology, internal medicine, and GI. So having that option was actually great. But in the long term, I have fallen in love with oncology and really have stayed there for most of my career. Now, some of the things that you'll see about obviously physician training is that it is more intense, it is longer, it is more highly specialized, and your scope of practice is obviously very wide, and you practice completely independently as a physician. No matter what kind of physician that you are. As a PA, you are going to have a scope of practice, which is going to be contingent on the state that you work in and the institution that you work in with how you actually function in your practice every day. For me, I function very independently. I see patients on my own. There is a physician, obviously, that I am in collaboration with that is part of my licensure that we work together as a team. But in day-to-day practice, I'm seeing patients very independently and making those medical decisions. So that's a little bit of a difference as well. But ultimately, getting a little off track, but kind of bringing it back to why I chose PA, I have to go with those first 4 things that I mentioned to you. One, I was a little bit older at the time that I went back to school, so time to training was really important to me. Flexibility and having a career that would grow and change with me as my personal and professional goals changed. That was number 2. Number 3, not having the requirement of being locked into a specialty and having a more generalist training. That would be number 3. Number 4 was the collaborative aspect and really having that physician partner to work with you. So I would say those are my top reasons for choosing PA over MD. Now, with that being said, I am married to a surgeon, and I have had this conversation with Dave many times. We both went through our training at very similar times. I was in PA school while he was in medical school. And so I could really see the difference in our training, which obviously medical school training is more intensive. It's longer. You're really getting more deep into the academic portion. And it really is meant to develop, physicians that are in specific specialties and experts in those areas, right? So for Dave, I asked him the same question. I said, well, did you ever consider not being a physician? And he was just like, well, no, I never thought of another option. Like I always thought I wanted to be a doctor and there was no other path for me. And I thought that was very interesting because I say a lot of the times that if you really want to be a physician, I feel like you know that in your gut and that you are willing to do all of the years and really commit yourself to it because that is your choice and that is your path and you know that in your blood and in your gut. But it's hard for me to say that not having made the decision, but he kind of confirmed to me that he wanted to be the expert. He wanted to be the end of the line. He wanted to have the entire, scope of practice and really be that last level of decision making. And that was something that he really wanted in his practice and in his, life and career. And so he hadn't thought, of being a PA or anything else. So it's a very interesting dynamic and difference, the way people think through their life and their career, and none of them are wrong. So whatever you decide, you just need to make sure that it feels right to you. I have never once regretted my career as a PA, not once. And there have been a lot of times where I've been asked that, or if I felt limited as a PA, my answer to that is no. I have really loved my practice. I have been fortunate to work on many amazing clinical teams with some amazing physicians who treat me as a partner and are very collaborative. And so I really feel that that making the decision to become a PA was and remains the right choice for me. And the choice that Dave made to become a physician and a surgeon was the perfect choice for him. We have 2 very different personalities as well. So it's a very interesting thing. But nonetheless, I hope this explains to you a little bit more about why I chose the PA profession and maybe gave you a little bit of insight into what that decision looks like. And sometimes it is more of an aha moment. But for other people like me, it was more gradual over time into saying, I'm not sure if this is the right fit for me. Let me explore other options. What are my options? What do I want my life to look like in the future? And how can my career help me get there personally and professionally? And I think those are really important things to think about in choosing any medical profession. But those are my YPA, and I hope that this video helped you in your decision making as well.